Assalamualaikum doctors. In this video I am discussing the glomerulonephritis history. So glomerulonephritis, we know there is what happened, inflammation of the glomeruli of the kidney. They have proteinuria, hematuria and hypertension, so headache. These are the features. First of all, the chief complaints it comes history from a mother whose 6-year-old had a 1 week of history of headache with dark color urine. So history of headache with dark color urine. Dark colored urine means hematuria. So first, as usual, the chief complaints analysis. Did the all comes together, the headache and the dark urine? Urine we analyzing like that, change in the color like dark or cola colored, amount oliguria or anuria, puffy eyes, is it frothy, odor, burning sensation, anyone measure his blood, random blood sugar, anyone measure his blood pressures, any enlargement in the private part preceded by sore throat or rash. This is very important, preceded by sore throat and rash. Again, how can we analyzing the urine? First of all, what about the color of the urine? Is it red or cola color? What are the amount of urine? Is there any oliguria or anuria present? What about any puffy eyes? Any frothy urine because of proteinuria? Odor of the urine. Odor, burning sensation of urine we ask because of UTI. Anyone measure random blood sugar? Anyone measure the blood pressure? Any enlargement in the private parts and preceded by any sore throat or rash? Then we go to headache. Headache is, analyzing is shock rate. First of all, side. Is it all over the head, forehead, or at the sides? Okay, so where exactly the headache? Severity. If I give you a score 0 to 10, 0 is the lowest and 10 is the greatest, how can he feel the headache? Then onset, when started, character, pressure like bending, radiation radiated to any side, association, vomiting, nausea, blurring of vision, hearing some voices, timing mainly in the morning or same all over the day, general fever, weight, activity, sleep, appetite, weight, activity, sleep. Other concerns are any dysmorphic features and chronic any illness. Okay. So headache, as usual, Socratic site, severity, onset, character, radiation, associations, timing, and general FWSL, everything we ask. Then we go the systemic review one by one, hematology, pallor, bleeding, recurrent bugs and bruises. GIT about the tummy size, tummy pain, poo, vomiting, pallor or yellowish discoloration of the whitish part of eye. Nutrition about the measurements and growth chart centiles. MSK muscle pain, skin lumps, neck swelling, size, mobile, red, hot, painful. Hair, nail, lip swelling, bone pain, joint pain and joint swelling. CNS was vision affected, unilateral or bilateral, redness of eye, hearing, fits, infection in brain, decrease the consciousness level, increase ICT sign, abnormal movements and weakness. Test about the recurrent bug, cough, dyspnea, musical sound, contact with COVID. Fears about the heart racing, exercise intolerance, awareness of heartbeats. Past history 5T IOA. So, what is 5T IOA? Any recent travel, visits to any farm, ingestion of raw dairy products. This is very important. Injection of raw dairy products, trauma to his tummy, exposure to radiations, history of blood transfusions, any medication he is using. So, hematuria, here is presentation. Hematuria, lots of things causes, like taking beetroot, taking any drug sometimes causes hematuria, trauma causes hematuria. So we identify these causes. Then parental history, the period before pregnancy, during labor and after that, do you have any concern? Vaccination, did he receive all his shots, any extra shots? Allergy, certain type of food or other allergies, development in detail if less than 2 years, family history of similar conditions, psychological impact, how does this condition affect the family, school, type of school, performance and attendance and bullying. So this is glomerulonephritis history, and how can we DD? I'm telling we can keep. First of all, it is a sequel of other vector viral infections. Acute glomerulonephritis, immunoglobulin N nephropathy, immunoglobulin nephritis, Hanoscolin purpura, chronic renal failure, mesangiocapillary glomerulonephritis, Alport syndrome. So for Alport hearing, we ask, is there any vision hearing issue? SLE we can keep. So this is the DD of this history. Thank you.